Hi all, welcome back to Angel Nurses channel. Learning theory is a method of improving knowledge and the practical is the method of application of your knowledge. So let us apply our knowledge in our practicals. Today, in this video, we will learn about VIP score, Visual Infusion Phlebitis Scale. As a nurse, it is very important to handle the intravenous line every day. In this video, we are going to learn about details, what is visual infusion phlebitis scale and how it is helpful for us. In this, it is really very helpful for the nurses to understand the healthy condition of the IV line. After understanding that, we can take a decision whether to continue use or we can discontinue the IV line. Infusion phlebitis is originated from main two sources. One is mechanical and another one is chemical. It is mostly occurring due to the chemical because of the concentrated drugs and fluids which we are administering through the IV line. And the minimal in mechanical, it is a patient movement or accidental removal because of the force of applying to the IV site. Through the VIP score, we can identify the stages of the phlebitis. As early as possible, it is helping to maintain the patient's safety and comfort. So now let us see what is phlebitis. Phlebitis is an infection or inflammation of a vein. It is occurs because of the IV catheter. It can lead to pain, swelling or redness. These are the symptoms we can see in a phlebitis. What is VIP scale? Visual infusion phlebitis scale. It is a simple tool to assess the patient's IV site signs of phlebitis. It is developed by a nurse. His name is Andrew Jackson on 1998. He was a nurse in UK. Before going to scoring, you must know the symptoms of the phlebitis. And the symptoms are pain along with the path of the cannula. There will be pain in the cannula site, redness around the site of the cannula, swelling, palpation, venous cord, and pyrexia. Pyrexia is nothing but fever. These are the symptoms of VIP score. Now let us see in details. What is the purpose of using VIP scale? We can early detect standardized assessment is happening, guide according to the symptoms we can give the care for the patient. It has to be documents. Purpose of the VIP scale is early detection. It is helping the nurses to identify the phlebitis at it early in the stage so that we can take an action. Otherwise, the phlebitis will turn to thrombophlebitis. Then it will go sometime for the surgical management. Okay. So, early detection it is very helpful for the nurses to understanding whether to resite, whether to we remove and resite the IV cannula, or we have to observe. There are different stages, different actions will be there. Standardized assessment, it's provide a consistent objective methods for all the healthcare staff to use. Guided care. The score help in the making clear decision on whether to continue monitoring the IV site or remove the catheter. Documentation, we have to document each time whenever we are observing the IV cannula, that we have to document. What is the use of document? It's provide a clear record for the IV site condition. One person to another person can understand what is the condition of the patient right now, their IV cannula, whether it is functioning properly, whether the new IV cannula has reinserted or not, or need to be reinserted. These are all help we will get it if we are keeping a proper IV cannula observation chart, VIP scale chart. In this picture, you can see the redness, swelling and palpable venous cord that are observed by vision. We can see by it is visible already. And the other symptoms like pain, we need to confirm from the patient. We should ask the patient whether he is having pain while pushing the fluids or when the IV fluid is ongoing. And pyrexia, that we should confirm from the temperature monitoring. Now let us learn about the scoring, how it is. The VIP scale scoring, it ranges from 0 to 5. A higher score indicates that a more severe cause of phlebitis. From what is a zero scoring? Zero scoring signs are there is no phlebitis. The IV site is healthy, and what is the action we have to take if we are getting zero scoring? Document and continue to the observation. We have to document it in the IV VIP chart and continue the observation every 8 hours. Every shift once we have to observe the IV cannula. If any one of the symptoms like pain, redness near to the IV site, we can score 1. Okay. If there is a possible sign of phlebitis, then you need to monitor the cannula site frequently, at least every 4th hourly we have to monitor and we should document. Slight redness near to the IV site, the action will be document and continue the observation every 4th hourly in score 1. If we find any two symptoms such as pain, redness or swelling, then our score will be 2. Redness, slight swelling or pain or redness. There will be only 2 symptoms. Then score will be 2. What is the action we have to take? Documentation has to be done and continue to the observation. If there is patient is accepting, you can consider to be reinsertion of the IV catheter in a different site. Whereas in a score 3, when we will give score 3, if there is a 3 symptoms like redness, swelling and pain, and the pain along with the IV cannula path. So, the action will be remove the IV catheter and document and inform to the doctor. The vein in this vein may be very hard and palpable venous cord is slowly visible in score 3. Score 3, we have to remove the IV cannula, reinsert the IV cannula and inform the doctor. In score 4, how we will give score 4? If all the following signs like the evidence is there, extensive pain, redness, swelling, palpable cord, then our score will be 4. If advanced, this is we are considering like a advanced stage of phlebitis. What is the action we have to take in this? Remove the IV catheter immediately and document, inform the doctor. In score 5, all the symptoms of score 4 will be present and along with that palpable venous cord also is there. It should be more than a 1 inch long. Action is remove IV catheter immediately and document and inform to a doctor. How to prevent this phlebitis and all? There are 8 steps for that. One is select an appropriate size cannula, the proper size of cannula which according to the patient's available vein, how it is, then accordingly you have to select the IV cannula size. Follow the aseptic technique while inserting, and when we are using IV cannula site for connecting the fluids, giving injections, we should follow aseptic technique. Choose appropriate site. So, if you are selecting 22 gauge of cannula, you can select appropriate site. You have to check whether I can insert this IV cannula, 18 gauge cannula, if I can insert in this vein or not. So appropriate site you have to. And folding part and all we should avoid. There is a chance it may get swelling and redness fast because patient's movement will be there. No, secure the IV cannula properly. If needed, we have to keep splint also to the patient so that patient will not be moved. Sometimes when sick condition, it is very difficult to get an IV cannula. So we will put, where we are getting there we will insert. So sometimes it will be in a joint part, in a movable movable part. So that moment what we have to do, we should keep a splint over there so that we can reduce the movement of the IV cannula. Transparent dressing has to be kept. Why we are keeping transparent dressing? Because it should be, the side should be, the pricking side should be visible, so that we can understand whether redness, swelling, anything is starting from the third stage itself. Flush the cannula before and after use and every 8 hourly once. Proper dilution of medication is very important, so that concentration will be coming down and blockage of the cannula can prevent. Label the IV cannula, date and time. When you insert it, when need to be removed. After 72 hours, we should reinsert the IV cannula. That is our protocol. What is the nursing responsibility? Regular assessment, documentation, patient education, prevention, and action. Regular assessment, assess the IV site at the least once per shift, every 8 hourly one time. And more frequently for the high risk infusions like potassium infusions, concentrated electrolytes and all, if you are giving, we should observe at least every 2 hourly, because there is a chance blockage can happen and then swelling, redness, all this will. So to avoid all those, we should check the patient's IV site every 2 hourly if concentrated electrolytes if we are giving to the patient. Documentation. Document and maintain the chart, VIP chart score is very important. That can give the information about the patient's IV site condition. Patient education. Educate the patient on what they have to report. If there is a pain, swelling, burning in IV site, they should report to us so that we can identify what is their feeling. It's a feeling of a patient, no pain and all. So they should inform us. Prevention. Use proper hand hygiene, sterile technique we should use, secure the IV cannula, catheter properly to prevent the complications. We should have use the wash the hands before touching, after touching the IV cannula. We should always use a sterile technique while inserting when we are using the IV cannula. And properly we have to secure it, should not be moved. Always if it is moving, there is a chance IV cannula will be getting swelling and it will be not used. We can't use. So today morning we inserted IV cannula. By afternoon if IV cannula is out, we are not able to use, swelling came. That means properly we are not taking care of the cannula. And we should educate for these things and all, we should educate to the patient also. What is the action? Always follow your facilities protocol. What the protocol we have given? We are given you the VIP score scale. So that you have to, the chart you have to maintain properly. And the nursing head has to be check each patient's VIP score twice in a shift. This is the commonly using IV cannula sizes: 14, 16 gauge, 18 gauge, 20 gauge, 22 gauge, 24 gauge. And one more will come, that is for the neonatal, 26 gauge, purple in color. Cannula size and color depends upon the color and the gauge, what commonly using for what. In this chart it is showing like that. The 22 will come in a blue in color, that is 40 ml per minute is the flow rate. Commonly using for small fragile veins, short term access. Okay, so because it is very, the gauge is very small and it is going only 40 ml per minute. So we have to use it only for the small cannula. Usually for the pediatrics only we are using. Pink color is for the adult, that is 20 gauge, 65 ml per minute, that is the flow rate. Routine infusion, post-operative patients, bolus for the drug administration, all these things we are using. 18 gauge is green in color, 100 ml per minute. That's a rapid infusion, surgical trauma for the trauma patient, and even for the blood infusion and all we are using. Almost all the surgical patient, 18 gauge we are preferring. 16 gauge is gray in color, 210 ml per minute. And major trauma surgery, massive fluid, rapid we need to give. Those patients we are using. Some other procedures also this 16 gauge and 14 gauge will use. for the this one abdominal tapping and all. 14 gauge is orange in color, 270 ml per hour. In emergency situations we are using, but very rarely we are using. It is very rarely IV inserting, and as an IV cannula 14 gauge is bit difficult, but for during the emergency situation we need to rapidly, very rapidly we have to give the patient massive fluid replacement, means we will use 14 gauge. All the gauges we are using according to the patient's vein, how it is, whether it is possible to insert only we are insert, otherwise there is we can't do it. Okay, I hope this class is helpful for all of you. Thank you everyone.